So as a nurse, I want to tell you and explain to you how important it is to me and of course my nurses to the aftercare. My job is not only to make sure and to ensure your safety in the operating room, but as well as pain management here in recovery, and which is most important, the aftercare. After you leave the OR or after you leave our facility, we still care about you. We're still gonna have to give you a call and make sure that everything is well with you. And any questions that you may have, we wanted to let you know that we are here to answer any questions that you may have. One of my biggest thing to me is to see your happy face come the next day on your post-op and say how happy you are with the results. So my job not only ends in the OR and recovery, but my job ends when you are happy with the results.
Do patients call our office after hours or at nights or on weekends? And what happens if they have questions like at that time?
Well, we do have an answering system which goes directly to our doctor. They page our doctor. So, for example, if you have a question in the middle of the night after surgery, don't feel alone. There is an answering system that will page your doctor, and your doctor will definitely give you a call back and answer any questions that you may have.
Do patients call you 1 week, 2 weeks, or whatever after surgery to ask you questions and ask you for advice?
Yes, they still do, which is okay. You know, these are things that we're not really educated on. So it is okay for you to know that we're here to help you and we're here to answer any questions that you may have. It doesn't matter if it's a week later after your surgery or if it's a couple months later. You know, even me after a year of having my breast surgery, I still have questions sometimes of certain feelings that I have. So it's never a wrong timing. If you have a question, it's always good for you to ask. Then later on, regret something.
What's been your experience and your interactions, not only with the patient, but also with their families?
I actually love interacting with the families. You know, I try to make every patient that walks in here feel like they're my sister or my auntie or my mom. You know, my priority is to make sure that you feel safe and that you feel secure in the place where you're going to have surgery on. So the way I love interacting with the families is, you know, obviously just saying leave your loved one here. I'll take care of them. No worries. I'll give you a call. Go ahead and have a coffee. You know, so I definitely enjoy that. And sometimes family members can be very fun to deal with. So I definitely love talking to them.